Good morning everyone, hope you're all safe and fine. I am Ula Ayad and my supervisor Dr. Muhammad. My presentation today is about lymphatic drainage of head and neck. The contents of this presentation is the introduction about the lymphatic system in general, the components of lymphatic system, the functions of the lymphatic system and lymphatic drainage of head and neck, organization of lymphatic nodes in head and neck, and finally lymphadenopathy. Of all the body systems, the lymphatic system is perhaps the least familiar to most people. Yet, without it, neither the circulatory system nor the immune system could function. Circulation would shut down from fluid loss, and the body would be overrun by infection for lack of immunity. The lymphatic system is an endothelium-lined network of blind-ended capillaries found in nearly all tissues, draining via collecting vessels into large vascular trunks that eventually empty via conserved drainage points into the blood circulatory system. Now in this photo showing us that the heart pumping blood to the arteries, arterioles, and then to the capillary bed, where the exchange of the nutrients between the capillary bed and the cells of the tissue. Blood plasma containing nutrients move out of the capillaries at the arterial end of capillary bed, while tissue fluids containing waste reabsorbs back at the venous end. However, not all of the fluid is drawn back to the bloodstream. At this point, about 15% of the fluid is left in the tissues and would cause swelling if accumulated. So the lymphatic system picks up the excess fluid and returns to the circulatory system. The lymph flow is enabled by the same forces that facilitate blood flow in the veins. It goes from lymphatic capillaries to larger and larger lymphatic vessels and eventually drains to the bloodstream via the subclavian veins. And of course, on the way, it passes through a number of lymphatic nodes that serves as filters, cleansing the fluid before it reaches the bloodstream. The blood plasma, once it enters the lymphatic vessels, it is called the lymph. The lymphatic system consists of the lymph, which is the recovered fluid, the lymphatic vessels, which transport the lymph, the lymphatic tissue, which contains the lymphocytes and macrophages, and the lymphatic organs, in which these cells are especially concentrated. The functions of the lymphatic system is to filter bacteria, foreign materials, toxins, and any harmful materials. It drains away excess fluid to prevent water block of the tissues and cells, transports proteins back into the blood supply, produces lymphocytes which protect and defend the body against the infections, produces antibodies to fight bacteria, and absorbs fat from intestine and transports it to the liver. The lymphatic drainage of head and neck. All lymph vessels of the head and neck drains into the deep cervical nodes, either directly from the tissues or indirectly via nodes in the outlying groups. The lymph is returned to the systemic venous circulation via either the right lymphatic duct or the thoracic duct. The lymphatic network of head and neck area is located in two layers separated by the deep cervical fascia. Now in this photo showing us that the all purple color, and this is represent the body regions that are drained by the right lymphatic duct. The place where the right lymphatic duct drains is at the junction of the right jugular vein and the right subclavian vein. The right lymphatic duct receives lymphs from the right jugular trunk and the right subclavian trunk. The right jugular trunk receives lymphs from the right side of the head and neck, while the right subclavian trunk receives the lymphs from the rest of this region. The yellow in color of this body is regions that are drained by the thoracic duct. The place where the thoracic duct drains is the junction of the left jugular vein and the left subclavian vein. The thoracic duct receives lymph from the left jugular trunk and the subclavian trunk. The organization of lymph nodes in the head and neck are there is superficial lymph nodes and deep cervical lymph nodes. the superficial lymph nodes, which are present in the superficial fascia, while the deep cervical lymph nodes are present in the deep to the deep fascia. The superficial lymph nodes drain the skin and superficial fascia, while the deep cervical lymph nodes, they drain the deep structures of the head and neck. The superficial lymph nodes, they drain into the deep cervical nodes, and the deep cervical lymph nodes, their efferent vessels from the jugular lymph trunk terminates in the right side in the right lymphatic duct and left side in the thoracic duct. This photo showing us that the locations of the superficial lymph nodes in head and neck, for example, the occipital lymph nodes, the parotid lymph nodes, the buccal lymph nodes, and all the other lymph nodes in the head and neck. And for the deep lymph nodes, for example, the infrahyoid lymph nodes, the internal, jugulo-omohyoid nodes, and all the others. Deep slides, I'm going to talk about the lymph nodes in head and neck and the structures they drain. So let's move to the pictures for more obviousness. First, the superficial lymph nodes in the head, which is the buccal, also called the facial lymph nodes. It is the lymph that ultimately passes into the submandibular lymph nodes. And the parotid lymph nodes, which is also called the preauricular lymph nodes, it gives drainage to the scalp above the parotid gland, the eyelid, and the parotid gland, the auricle, and the external auditory meatus. And for the mastoid lymph nodes, which is also called the retroauricular lymph nodes, they give drainage to the scalp over the ear and auricle. The occipital lymph nodes, which gives drainage to the back of the scalp. As for the superficial lymph nodes in the neck is the submental lymph nodes, which gives drainage to the tip of the tongue, floor of the anterior part of the mouth, the incisors, central part of the lower lip, and the skin over the chin. The submandibular lymph nodes, which gives drainage to the front of the scalp, nose, cheek, upper lip, and lower lip except the central part, the frontal maxillary, and ethmoid sinuses, upper and lower teeth except the lower incisors, and the anterior 2/3 of the tongue, floor of the mouth, and vestibule and gums. And for the superficial cervical, which gives drainage to the skin over the angle of the jaw, skin over the lower part of the parotid gland, and the loop of the ear. And finally, the anterior cervical lymph nodes, which gives drainage to the skin and superficial tissues of the front of the neck. For the deep lymph nodes, there are lymph nodes which is located in the midline of the neck, and lymph nodes located on each side of the neck. For those on the midline of the neck are the peritracheal lymph nodes, which gives drainage to the thyroid and the trachea. For the peritracheal lymph nodes gives drainage to the esophagus, trachea, and larynx. The laryngeal, which is also called the infrahyoid lymph nodes, gives drainage to the larynx. On each side of the neck is the upper cervical lymph nodes, which is also called the jugulo-digastric group, gives drainage to the tonsil and tongue. The lower deep cervical lymph nodes, which is also called the jugulo-omohyoid, gives drainage to the tongue. The lymphadenopathy. The lymphadenopathy is the abnormality in the size or consistency of lymph nodes, whether as a result of normal reactive process or pathology. The abnormality might be generalized or localized. The generalized lymphadenopathy is enlargement of two or more non-contagious lymph nodes grouped. The localized lymphadenopathy involves the enlargement of a single node or multiple contagious nodal regions. The symptoms of lymphadenopathy include the swollen lymph nodes, pain in the lymph nodes, and fever. Lymph nodes are part of the immune system. They help in the body fight the infection, and they can get inflamed or swollen for several reasons, like for infectious diseases, which can be viral or bacterial, immunologic diseases, malignant diseases, endocrine diseases, lipid storage diseases, or any other disorders. In this picture showing off the locations of the lymphatic nodes and the causes of a swollen Like for example, the preauricular nodes, if it's got, which gives drainage to the scalp and skin, if it's got swollen, it could be a scalp infection or microbacterial infections, or it could be malignance, which causes of the skin neoplasm, or the neck squamous cell carcinoma. And this picture showing us the localized lymphadenopathy in the neck and in the face and how it is swollen. Thank you for your attention.